mindful that we're recording just as my son, who's just finished school, is coming down the stairs, despite me saying, Sethy, stay in your room. So apologies for that. Natalie, David, Clive, it's great to meet you. What we'll do, because this is a smaller group, I'm quite happy that I'll present the slides, but if we want to do this more of a discussion, if you've got questions, if you want to kick things about, I think if it's in the interest of others, then we'll discuss it. If it's a very specific point, then I'm happy to email and chat at a later date. So you've been good enough to join us this morning, so I'm more than happy to support you best I can. What I'm going to do is that dreaded share my screen, which always takes longer than you think, but hopefully is that coming up on my screen now?
Yeah.
Fantastic. Super. So just to introduce myself, I'm Rob Easton. I'm the head of consultancy at Shield Safety Group. Also on the call we've got Danny, good friend and all-round nice chap, who also happens to be our sales director at Shield Safety, and an avid golfer, aren't you, Danny?
Well, I think I am.
The others can decide.
Yeah, I turn up.
So the session I'm doing this morning is around keeping your business open and trading safely. Now, obviously, with the change in requirements on the 19th of July, the guidance being issued 2 days before it all happened, and people are asking questions and wanting to have a little bit of clarity. So I'm going to do a summary on those, and then I'm just going to talk about some of the wider safety implications. So all the stuff, whilst we're talking about COVID, what are we forgetting about? And arguably for me, there's business interruption. We know that there's issues in the with employees. We know there's issues in the supply chain. So let's just have a talk about those and just be mindful of what else is going on. And then at the end, I've got a couple of slides just to share on allergens. Because again, whilst we've been talking about COVID, what we haven't been talking around is the changes in October this year, implications on businesses, and what you can be doing now to be thinking about allergens in preparation for when the law comes into force at the end of this year. So that's the plan. Like I say, it's a nice group, small group. So I'm happy to take questions and make it more conversational if that's what people will get most from this session. So as I say, head of consultancy here at Shield Safety. A little bit about us as a business. I'll flick over the first slide. Is Shield Safety, well, we've been trading since 2003. The highlights there is we're the largest employer of environmental health practitioners in the UK, and we are supporting retail, hospitality and leisure businesses up and down the country, have done for many years, and indeed our team of auditors are out auditing today. Our team of safety consultants are out supporting hospitality, hotels, golf courses, in basically we believe in making safety simple. So how do we create an environment which safety is simple, it's understandable, and how can you report on that performance and prove the steps that you're taking to improve the safety culture and performance of your business? So a couple of the key partners there, we're very proud to work with Milton Keynes. You can see in the middle, we have primary authority assured status with Milton Keynes. That means our policies, if you sign up to them, they have the primary authority assured status, meaning not only do you have the weight of Shield behind you, backing you with your safety, you've also got the Milton Keynes, which is recognised as a partner. And a couple of other ones there, the Food Standards Agency, Food Standards Scotland. Again, we're working very close with those government agencies, looking at food safety in the future. How is it enforced, and how there'll be a lighter touch from the local authorities and the use of organisations like Shield, this third-party accreditation, to prove how you're managing safety. So therefore the EHOs will come and see you less often, which I'm sure we'll all be very thankful for. I say that as an EHO myself, and also my wife is an EHO and in earshot as well, so I'll be careful going any further. And then the last one there is the Safe to Trade scheme. So that is something that we created over a year ago now in response to COVID-19, and that was about getting employees and guests and indeed members of golf courses back on the green, back to hospitality venues, and giving that reassurance to employees, members of the public, that it was indeed safe to work and safe to trade. So there we go. That's a little bit about us. Let's just now cover off a summary of COVID controls. So can you all see that slide okay?
Yeah.
Perfect, thank you. So what I've done is I've done a simple what stays, what goes, and what's enhanced. I thought that was the easiest way to cover it off. For those that have read the latest guidance, you'll see that it's slimmed right back. and a lot of it is around risk assessment. Now, I know it's a challenge at the moment. What is reasonably practicable? We talk about that in health and safety law. We know organisations are looking at other businesses to see what is a reasonable control, and we are in that bit of state of flux at the moment about what do people, what is the normal. I'm just going to remind my son that I'm on a call because he's chatting way upstairs. Just 2 ticks.
What's the difference in the face?
I feel so bad. He's just said, "No, I'm trapped, Dad. I want to come down." So apologies. This is the reality. This is life now, isn't it? We all have a little insight into people's worlds.
Yeah.
So what we've got here is basically a stays, goes, and enhanced. I'm just going to talk through each bullet point. If anyone's got any specific questions, I'm more than happy to pick them up as best we can. Obviously, with the caveat that this guidance is just we've had it for a week and we're still trying to work it out, and we're still sort of tiptoeing our way through it. So let's do the easy one. What stays? Well, enhanced cleaning, we're all familiar with that. We're familiar with the sanitizing of surfaces, making sure that the chemical is effective against COVID. So again, I think that will become the new norm. There will be an expectation from guests, members of the public, to see this almost theatre of cleaning, that you are taking those extra steps. Hand washing, again, it talks about enhanced hand washing, so making sure that your team toilets, your customer toilets are properly stocked, and again, provision of hand sanitizers at the entrance and throughout. And I know in reading the Gulf England guidance, that's one of the few things that they've said is to maintain that high level of hand hygiene. Now, again, we'll watch this and we'll all be watching to see where other businesses move. Most of our clients are maintaining the hand sanitizer throughout. Again, if you visit the high street, you're seeing it at the entrance to shops. So it feels, for at least the time being, that is the new norm. And we'll watch closely to see if that's maintained. Managing an outbreak, there are still outbreaks. Definition of an outbreak is 2 cases or more linked to a property. And it's happening because cases are going up. Arguably, one of the biggest issues we're facing is the rise in cases and managing and dealing with that as a business. And we're seeing that with disruption to team members. Risk assessment is absolutely key. And in fact, I almost put this in the enhanced column because it's referred to more and more as about, it's for the business to risk assess, identify the hazards within the business, and then put in reasonable controls. But the risk assessment is absolutely key. What has gone is the requirement strongly suggested that the risk assessment is shared with members of the public if over 50 people. That's kind of disappeared off and is no longer talked about. So there's a need to train and instruct your team on the risk assessment, but there's no longer that heavily suggested approach that you need to communicate it to members of the public. And then, of course, you're always going to have communication and training. So whatever the findings of your risk assessment are, whatever your safe systems of work are for COVID, then that is to be communicated definitely to your colleagues, to your team members, but also we would say that should be communicated to your guests, and that's mainly around controlling points of aggression. We're seeing it in a lot of the retailers, points of violence where there's this conflict. So if you are changing your guest offering, if there are different approaches to tea booking as an example, is making sure that your guests, your members are still aware of those controls, so it takes away that point of aggression, that point of conflict when they're visiting the course. So my hunch is that the actual controls for members of the public and members of your course are reducing, so therefore there's less restrictions on them. But where there are restrictions, we would be recommending that these are made known through websites, through booking of games. Yes, Gavin, I can see you waving at me. No, we're okay. No, that's a no. There we go. Perfect. So what goes? Well, we've heard that social distancing goes, but when you get into the guidance and look at the detail, it starts talking about knowing areas of increased contact and reducing those. So it's social distancing, but watered down and then by another name, I would suggest. Now, that's obviously focusing on your colleagues, your team members, and you still have to identify roles where there may be increased contact with people, therefore a higher risk of COVID. And once those roles are identified, then you can look at the provision of perspex screens, and if you need to reduce the number of people in those areas. So, like I say, social distancing as an absolute, you won't find it in there, but it does still talk about identifying close areas of close contact and ensuring controls are in place. Mandatory mask wearing, I'd be interested. I've been out and about a fair bit over the last week, and I'd say it's probably about 50-50 of people wearing masks. Some are just donning them as they're going into restaurants, and others aren't, and it changes. So I'd be interested in any feedback and what the experience of your members are, Gavin, on mandatory mask wearing. Of course, what we can do there is for members of the public and for members of your colleagues, members of the team, your members, is if they want to wear a mask, then you should facilitate it, you should encourage it if they feel safe to do so. There may be also other roles where you identify, again, going back to that close contact, there may be certain roles that you say, actually, we will continue to wear masks for this role. Compulsory recording of visitor details, that goes. So the compulsory scanning in using the QR code, that is dropped out. However, if you are still maintaining the QR code, then there is a requirement that you put in a pen and paper or a localized version, which is, again, considering it's a voluntary approach. But if you do choose to use it, then there must be a means to collect your guest details other than using the QR code. And I'm sure there'll be some questions around that and some thoughts about the ping and the NHS app. And then obviously the work from home. So there is this desire to get people back to the workplace. But if you have people that are extremely clinically vulnerable, still considering what roles they can return to back on the course, back in the establishment. But that mandatory work from home is being removed, and seeing a return of the workforce back to the offices, shops, and back to your courses. So that's the bits that goes. The one that's enhanced, and I'll talk a little more about, is ventilation. Now, obviously, that's not a problem out on your greens. Perfect. You've got these very large open areas, and I think that's where I'll be spending most of my time. But there is this enhanced requirement around ventilation. So reviewing your enclosed spaces. So this may be your clubhouse, it may be the changing rooms, it may be meeting rooms, actually reviewing all enclosed spaces on your property and identifying those with poor ventilation. And once they've been identified, then taking mitigating action, which is, can you increase the ventilation, opening windows as far as possible, opening doors, using forced mechanical ventilation. If you're not able to do those things, then look at whether the space can be used or reduce the occupancy of it. And that's going to be a problem where you've got rooms within rooms, so say you've got a small manager's office within another room, and there's no natural ventilation, no forced ventilation. Now, if you've read the guidance, there is, and I've got to be so careful what I say here, and I'm very mindful this is being recorded. There's a lot of information around CO2 detectors, and saying businesses can use carbon dioxide detectors to identify the carbon dioxide levels in the atmosphere, and based on that, the ventilation is inadequate. Speaking to my environmental health practitioner friends, colleagues, those in enforcement, they're all completely flummoxed by this. They have no idea how it got into the guidance. It stands out a mile from the rest of it, which talks about general approaches, then puts a very specific requirement in there around CO2 monitors. So it's there. If you've chosen to buy CO2 monitors, if you're using them to monitor the air quality, okay, but I would be recommending that that's not necessary. We've all done very well. We know when we walk into a room and you can say it feels a bit stuffy in here, or the rooms, you'll know your premises where you just go, it's not nice having a meeting in there because it's always stale. And we know this. We've been doing it long enough. So I think that assessment, there's no requirement to use CO2 monitors, and we're a little bit confused as to how it got through. And even we've had access to the HSE's enforcing notes, they're inspecting notes, and they'll talk about CO2 monitors, but they're not pushing and they're not making it an absolute requirement. So again, if anyone's got any questions about that, if they've read the guidance or they've heard this, read it in the press, the absolute requirement is to ensure that there's the best ventilation possible, but there's no requirement to use the CO2 detection. So before I sort of move on to the wider implications of safety, other things to consider, is there any questions around COVID controls and what stays, what goes, and what's enhanced? Anything at all? It's also my opportunity to have a sip of coffee. Perfect. Okay. Well, I'll be honest, you're probably all bored of COVID. So we've been talking about it for a very long time, and almost exclusively for the last year and a half. So what I want to talk now is about some of the wider safety implications. Again, going back to what haven't we been talking about whilst we've been talking about coronavirus. And there's a couple here, and if you've heard me present before, or if you've read any of the blogs that we regularly write and put through LinkedIn and through our website, one of my absolute favorite topics is about resources and capabilities. So I apologize that I'm talking about it again, but it's more important now than ever. And what I talk about resources and capabilities is, we know when we investigate accidents, alleged food poisonings, it commonly goes wrong where there's a mismatch between the resources and capabilities of an organization and what they're trying to do. For an example, we'll deal with restaurants where they want to be doing weddings, there's 200 people, and guess what, there's an outbreak of food poisoning. Then when you go and investigate, what you find is actually they didn't have enough fridges to keep the food adequately cold, they didn't have enough team on, so the team were rushed, so they weren't washing their hands properly. So have they got the equipment, have they got the skills, have they got the capability to do what they aspire to do? And as soon as there's that mismatch is when things go wrong. And what we have to look at now is what's happened in the last, let's say 4 to 12 weeks, that is changed the resources and capabilities on organizations and changed it on golf clubs. So I'm just picking up on some of those and just saying it's a chance to go back and look at your offer, look at what you're doing for your members and members of the public. Now, the first thing is businesses have expanded the offer. We've seen that. The reason we love hospitality, isn't it, Danny, is because of its creativity. That it's an industry that sees a problem and it finds a way around it. And what that's meant in hospitality is repurposing of areas. So, okay, indoor areas were closed. So what do? Is we put extra benches outside. We put an open marquee in the car park. And what hospitality businesses, including golf courses, have done, have expanded their trading area, because their traditional inside trading area has not been able to use. Now, one of the things that we're finding is businesses are still maintaining that area. So let's say they had 100 covers before inside, they stick another 100 in the car park, we stick another 100 outside on the patio, and suddenly an organization that had 100 covers previously is now trading at 300. And of course, the concern there is, as inside comes online, as demand increases, as the weather's nicer, this business was designed, the kitchen was designed to deliver 100 covers, and now suddenly, without thinking about it, it's got 300 that it has to service. So it's just recognizing that, and it's almost happened by stealth. Is going, okay, how is our business different to how it was originally set up? And we've seen it grow and grow, and it's really hard, because no one wants to say, let's go back to 100 covers, let's rein it back in, but there just has to be that stop and go, actually, can we safely deliver to the total organization, the total business that we've created now? And that may mean reducing covers back, it may mean looking at the menu, it may be increasing team, but know that the business, that for many businesses they're trading now, is different to the one when they went into the pandemic. The next one is around team disruption. We saw this, going into the summer. Numbers in hospitality, chefs were reducing. We know about the shortages, and that's just got progressively worse and harder as more self-isolating. And we have to recognise that disruption in the team. And again, an organisation that carries on trying to do what it's always done without recognising the changes in resources, it's going to end badly. So it's recognising there is that disruption in the team, and we are unfortunately seeing businesses that are limiting trading hours. It doesn't have to be that extreme, but it's looking at the services, it's looking at the menu offered and going, what can we do safely within the capabilities, the team numbers we have? And sometimes it's about stopping and considering that and not carrying on regardless. And I know that's hard, because again, we have this, the show must go on, we can do it, we'll battle through, come what may. But actually there's that point where you have to stop and say, actually, can we do this safely? What do we need to draw back to do within the team that we currently have and within their capabilities? And then the last one to cover off there is the supply chain is bumpy. We're seeing this. We're seeing disruption to the supply chain. We're seeing that through our supermarkets. Again, a lot of our clients, particularly in hotels, are reporting outages on stock. And that creates its initial problem, of course, managing allergens, which I'll talk about in a little bit. So you're seeing substitutions. So how are you changing your allergen management to recognize the substitutions? The other immediate response, and I think of my time in pubs, Danny, and that's where you knew me for a long time, is we know that if supply chain is bumpy, what do chefs do? Well, they order more because they're fearful. They're worried. Well, the pies aren't going to come in next week, so I'll order 3 times the amount. And as soon as we lose faith in the supply chain, you get overstocking, and of course that presents its own food safety issues, because you're now carrying more stock. Used by dates. Are you able to check for pests? Increased cross contamination. Have you got adequate storage? So for those of you that have, and I imagine it's most of you that have got these kitchen operations within your courses, just go in and look at that. Check your stock levels. Make sure that the team aren't, we call it the bullwhip effect. So a minor change at one end of the supply chain is amplified by the time it gets to the other. So just go in and that extra careful eye on your kitchens to make sure that they're not overcompensating. Now, obviously, I've talked a lot there about food safety in relation to businesses, but the same applies to the golf siding as well. For example, teams are disrupted, recognizing that you're going to have more people self-isolating. How can you maintain your greens? How can you continue to do that safely? So you may have to look at changing your services, your offers, number teeing off, recognizing that team numbers are probably going to be limited at some point. And then the last thing, just to wrap up on that, is recognizing the changes in the expanded business, changes in the supply chain, maybe a different offering, is your safety systems need to recognize that. So again, go back to your business and say, do our safety systems, do our policies, does our health and safety management system, our food safety management system, our fire risk assessment, do all of these policies and legally required documents reflect what you do now, the operation as it is today, not the operation that you were running as we went into the pandemic. And of course, it's absolutely key to make sure you've captured that, and it is the business now, not the business as was. So before I move on to allergens, is there any questions around sort of the wider implications on safety? Anything there to expand? I'll happily talk about resources and capabilities until the cows come home. It's one of my real passions around ops management and safety. So I don't know if there's any questions or thoughts on that.
Yeah, I think Rob, thanks. Yeah, that's there's I think what we're seeing is issues with supply. As you rightly said, so you've possibly got fewer members of staff being pinged, etc. Even just trying to get staff was a problem before, and now it's that's exacerbated. And then as something we talked about before we came on the call was that a lot of golf clubs have sort of pushed their diary back, their calendar of events towards the end of the year. So you've got the demand has increased and you've got the supply has decreased, and that's obviously created a huge amount of problems for club managers. So I guess really any advice on that? Perhaps one of the managers on the call would like to come in at that point. Trevor, David, Gail, or Clive, is that something that you're experiencing?
Hi Gavin, yeah, hi Rob. Yeah, we're definitely struggling with staff, and your comments earlier, Rob, about expanding the capability. We put a marquee up, we've gone out onto the patio, we put a call button system in. So the members don't have to come to the bar, they just sit at the table, press the button when they need service. And of course that means we need twice as many staff on, and we actually can't get the staff. So it has, as you suggested, it really exacerbated the problem. We've after the 19th, we've had a lot of our members pinged over the last couple of weeks, and a couple of them tested positive as well. So we're very nervous about taking any of the guidelines off. In fact, we've stuck with, as of the 19th, we've stuck with the one-way system, trying to stick with the table service, and the staff are all wearing masks in the clubhouse as we are when we're walking around. And generally the members are as well. The members see the staff with their masks on, and they think, oh, I better put mine on as well. So that's kind of helping. But supply wise, I don't know that we've struggled with catering supplies. I mean, some of the brewers aren't brewing all of their brews, but generally food wise it's been okay. yeah, the building materials are the things we've struggled with. A couple of building projects on, and apart from them rocketing in price, actually getting hold of stuff, cement, timber, insulation panels, all been a nightmare. Yeah.
Trevor, that's fascinating. If I may, I'm just going to pick up on something you alluded there, which is we're obviously talking a lot about COVID controls and stopping the spread of COVID, but also there's this business interruption side, and where you've talked about members being pinged and testing. No, if you do get those cases in your business, then that's seriously impacts it. So the controls that you're looking to put in place, increasing that maintaining that 2 meter distance where you can between employees, if that's possible, the implications there are is you can continue trading. So now it's as much about business interruption. And Danny, I hope you don't mind me sharing the story of our office. We had a situation where we had someone test positive in the office, and there was a worry that was it. We would have to close the lot down. But what we were able to demonstrate is we maintained the 2 meter social distancing. We had the controls in place in the risk assessment, which actually it was just the one member of our team that had to self-isolate. So actually maintaining those controls within the business has meant that we haven't been interrupted. So
it's a good point though, Rob, because even the office manager was confused with the rules, and there was an hour of confusion where Kay was preparing to send everybody home because she thought that was the situation, and there's other people doing the same thing. And then there's new rules coming out this morning for supermarket workers and lorry drivers that if they are pinged, that they don't have to self-isolate if they can prove that they can go and get a test and things. So it's a moving feast, isn't it? And it's going to get more and more confusing as time goes by. But that's why, without doing a sales pitch, the helpline is there for all of you. For any GCMA member, the helpline is there to ask any questions. It's it's free of charge for your membership with the GCMA, so you can call into. It's probably not going to be Rob unless it's at the weekend and he's on call. But there's always going to be somebody of Rob's with not Rob's knowledge at the end of the phone that can help you and put your mind at ease if you've got any problems or questions or queries or you're panicking about something. Just pick the phone up and call the advice line.
Yeah, absolutely. You've got that. We're very proud. They're all environmental health practitioners. They're all part of my team. We pride at the level that they will be able to give you that EHO insight to support. So having that EHO there when you want them, that's what the safety advice line does, isn't it, Danny?
Yeah.
Is that that time when you want to be able to pick up the phone and talk to an EHO and just. It may be that we're thinking of doing something. Can you talk us through it? Or this has happened. What do I need to do next to manage this through and to make sure we would never advocate. It's not about avoiding EHO action or bending the rules. It's about, okay, what steps can you take now to reduce the risk, or what investigations you need to undertake. So it's about being that that person to call upon to support you when.
Just conscious of time, Rob. I think
perfect.
You just whiz through the last couple of slides.
Yeah. So we've got. I'm just going to talk about allergen management. The first slide I'm not going to spend a lot of time on because I'm sure you're very familiar with it, which is around the significant cases. So those 2 cases that have brought the changes that we're seeing now, and indeed it's known as Natasha's Law, which is around the pre-package for direct sale to the consumer. So these are the significant cases. The next point was the government's response. So we've seen some varied responses. So we have Natasha's Law that comes into force in October, around pre-packaged food for direct sale. So that's the enhanced requirement for labelling. So that's to include full listings of the ingredients and identification of the allergens on that label. And that is coming in October. With Owen Carey, there wasn't any changes in the legislation, but what we have seen is a real focus by the government on informing consumers about their rights with regards allergens. So not just pre-packaged for direct sale. This is around people knowing what they should expect when they visit a business, when they visit a food business. And then the last one is on local authorities. We're seeing individual local authorities, and it would be unfair of me to name them, but they are going out there and doing their own thing. Which is really tough because we have the law, we have a common understanding, and then when local authorities decide to do some localized action, it's a real challenge. But again, that's why we're there to support, because we understand the law, we understand what's really required upon a food business, and we can support and challenge some of these things that are being requested. So with all of these changes with allergens in mind, we've just put together some focus areas for you to reflect on. So the first one is prepackaged for direct sale. Again, this will apply to some of you, but the first thing you need to do is go out and look at your business and say, do we have any foods that are considered prepackaged for direct sale? Now, what does that mean? So that means the food is packaged before the point of order. So I'll give an example. Let's take McDonald's or a similar burger restaurant. If you order your burger and then they make it and wrap it, that's not pre-packaged because they've made the food after you've ordered it. They've put it in wrapping, so it's not pre-packaged. Now, the difference would be is if I go in and order my cheeseburger, they've already got one made in the chute. It's already been made. It's already been wrapped. Then that food item will need to be labelled with a full list of ingredients and allergens. So that's a basic of which side of the law will your business fall upon. So my advice to you would be look at your operation and say, is there anything where you are doing pre-packaged food? So that might be sandwiches that are wrapped and put on the bar. It may be but the key to it has to be wrapped. So a pork pie that isn't wrapped and is just placed under a glass dome, that's not wrapped. But as soon as you're making a sandwich and that's wrapped, if you're doing picnics, but just look at it and say, is it pre-packaged before sale? So, and is the packaging destroyed? When you open it, is the packaging destroyed? Danny's got his hand up there.
We've got a halfway house, and you can get sandwich. They do sandwiches, and they do fresh fruit, and they do hot pies, sausage rolls, and things like that. Now, if you get a pie, they'll sometimes put it in a little bag, a little white bag, and you'll put it on your golf cart, and you'll drive off with it, or you'll just walk off, however you play it. So two questions. One, the sandwiches, I know for sure they're made in the morning, and then they put them in the little clear wrappers.
Yep.
So I guess that's classed because that's pre-packed, isn't it?
Yeah, exactly right.
But what about putting it in a little white bag to carry away a hot pie or a sausage roll?
So if you're an easy one, if it's in a tray like a burger tray or not, that's not covered. What I'd be advising there, Danny, is that the pies are only put in the bag once they're ordered, and then it just removes the need. There's no question about it being pre-packaged. So have the pies open and then place it into the bag once ordered.
Right.
If that helps.
Yeah. Thanks.
It's obviously there's still the requirement to provide the allergen information for that pie, but it doesn't have to be on the label. It doesn't have to be affixed to the bag. So you still have to provide the allergen information if requested, but it wouldn't come under the PPDS. It is difficult. We're dealing with one of our clients at the moment, which is a baguette with they call it a watch strap, and the actual that's just a small. You'll be familiar with them from service stations, and we don't know. There is that pre-packaged because it's only partial. It doesn't have to cover all of it. You could, in theory, remove the watch strap without it being damaged. So that means it would fall outside. But there's going to be lots of areas that do need talking through. It's not as black and white as you'd as perhaps you'd anticipate. Actually, you probably would anticipate it. There's areas of confusion, but again, as Danny's alludes to, we've got the safety advice line if you want to ask those questions. So, but the first thing is go out, look at your business, identify if you've got any that are definitely pre-packaged for direct sale. If you're unsure, then use the safety advice line, and we can support there. Clear communication to the guest is key. That's what came from Natasha's Law and Owen Carey is if you have allergens, if there's allergens in your material, what your allergen policy is. And again, going back to where supply chains are being disrupted is making sure that allergen information is updated and your guests, your members have the latest information. It must be easily accessible and easy to interpret. Again, that was the findings from Owen Carey, is that the menu descriptions were very poor. The allergen matrix was not easy to understand. So therefore mistakes were made. So think about your guests. How do they receive that information? Can they make informed decisions the way it's presented? Be flexible to change, because again, we're talking about disruption to the supply chain. There may be changing expectations from your guests that they want more information. So and you might have new ingredients coming on. So just make sure any system you put in it can be changed relatively easily. Consider the role of team in managing allergens. We know we can put all of these systems in. We're doing a lot of work at the moment around root cause analysis on allergen cases. And often it comes down to it's that new team member who didn't write it on the waitress pad or failed to press the right button or didn't really understand the significance of allergens. So look at the role the team members play. Do they all have an understanding of what their role is and how to manage allergens safely? capture the changes in spec and ingredients. I've already said that, but it's important. So guests may come, you have members coming in, and on a Friday they have the ham, egg and chips, or they have the pie and have done so for 20 years, and they know it's okay because you've always cooked the pie the same. What you want to be saying to people is, actually, if you do have an allergen, please make sure you check the allergen matrix every time you visit, because there are changes in ingredients, there are changes in suppliers. And again, we've seen cases where exactly that's happened. The guest assumed it's the same product as the 20 times before, but we'd be saying every time, please check our allergen matrix, just in case there's been a change to the recipe or ingredients. And then the final one we would say there is show that the system is robust. And how do you do that? You do that through a system of internal checks, through your daily and weekly records to ensure your allergen controls are in place. But there's then also that third-party auditing. EHOs have been visiting less. They will continue to visit less in the coming months as they're dealing with the backlog. So you look for that other pair of eyes, that third-party assurance that your systems are up to scratch. So when the EHO does come, you've already had that visit, you've already had that inspection by an auditing company, and that means that, there's no surprises, and your systems are robust enough and up to scratch. And there we go. So that's a brief, and I'm mindful on the time, so because Danny's good at keeping me on track. So thank you, Danny.
Thanks, Rob.
So really, that's it from me. That's all my slides. But I'm happy if there's any questions to answer as best I can. Everyone happy?
No questions in the chat either. So.
Well, super. Well, for me, Clive, I'm happy to. Gavin, I'm happy to wrap it up there. I don't know if you have any thoughts or any closing remarks.
Yeah, no, absolutely, Rob. I think that's a very good update of where we are today, with regards health and safety, food safety. Lots of food for thought.
You've been waiting for that, haven't you?
Yeah, I've had that one going about 10 minutes into. But no, I think it's it's a very useful reminder of the sorts of things that we need to be looking at, and the effects of the current situation. That sometimes you've got an awful lot of balls to be juggling as a general manager, and sometimes you'll drop one. And so I think just keeping an eye on all of those different areas is absolutely crucial, and just that reminder of what to be looking for, I think is very, very useful. So thank you very much, Rob. Thank you very much, Danny, for today.
Yes, that was up until it was all...
Yeah, getting some thanks through from the members as well. So
yeah, thank you very much. Excellent.
Yeah.
Thanks, guys. Thank you.
Absolute pleasure.
Good. All right, so we'll wrap it up there. The recording will be available, hopefully in today's e-newsletter, and so I'll get that sent out as well. So we'll get the number of people viewing this right up there.
Thanks very much.
Thanks, Rob.
Right,
Perfect.
right guys.
Go
Cheers,
safely.
guys.
Take care.
Bye.
Bye-bye.
Thanks for that. Talk soon.